The Desert Healthcare District and Foundation presents a podcast that supports your health and wellness where you live. This is Healthy Desert, Healthy You, hosted by Will Dean. Now, here's Will.
Hello, friends. Welcome to another episode of Healthy Desert, Healthy You. Today, we're talking about a very important topic for the Desert Healthcare District and Foundation. But before I introduce our guest, I want to give you a little bit of background on the topic. So if you follow us on our website and social media, you're probably aware that 2026 is an exciting time, a pivotal period and transitional moment for the district. We are currently engaged with a consultant, Sowen, in developing our next strategic plan. This is a plan that identifies our goals and priorities for improving access to health and wellness for Coachella Valley residents. It's especially important as a guide that our board and staff will follow to determine the services and programs we fund, as well as the policies we support for the next 5 years and beyond. My guest today is an integral part of the strategic planning process. Dr. Angelica Geter is a healthcare and community consultant with Sowen, who is going to help me break down the strategic planning process and how Valley residents can be a part of the process. Welcome, Dr. Geter.
Oh, thank you so much, Will. I'm so excited by our conversation. We've been working really hard with our partners at the district, so I'm excited to dive in.
Same here. So why don't we start with just the basics? What is the strategic planning process? What does that entail? And what is your role in that process?
Oh, absolutely. Actually, I'm going to take us a little step back to just think about how Sowen got here. So Sowen is an impact consulting firm. We've been doing this work for a very long time, and our team encompasses leaders who specialize in addressing things around strategic planning, health equity gaps, understanding the needs of our community. And so this is something that we are so passionate about. When the opportunity came for us to apply to be the consultant to lead this work and to support the district, it was a no-brainer for us. So I'm so excited. The strategic planning process has been led by multiple members of our team, but Sophie in particular, she's been at the helm of this work. And our process has been very intentional, very thoughtful, working with leaders of the district around the staff, working with the board of directors, and engaging members of the community to really ask the questions about what is the role of the district? What is the impact that they want to make? What can be done as it relates to the strategic plan, and how can we be most impactful? The part that's coming up is our engagement with the community, thinking about those community sessions. So we can talk about that a little bit more in a few minutes.
Great. Well, that's a really exciting part for us. And you mentioned that we've been working on this a while. I believe we began in late summer 2025.
Absolutely. We began in August, and it continues on through May. And our final report will be coming out after that.
Okay, excellent. And I know that there have been meetings with our grantees and stakeholders. Tell me about that, the objective of those meetings.
The objectives of those meetings is to be very clear about who is a part of the conversation, make sure that we are identifying every community that needs to be engaged in this process. We want to be very clear around language, cultural factors, understanding the perspectives and experiences of our residents, of our residents who are a part of the strategic plan in the Coachella Valley and beyond. We are also thinking about how do we ensure that we reach as many people as possible, because we know that access, being able to come to these conversations, being able to access the survey that we're going to talk about in a few minutes, sometimes that can be difficult and there are some disparities. So the purpose of those conversations was to ensure that we're talking to as many people as possible. And we want candid conversation and feedback.
Absolutely. And so you mentioned the residents. So we have scheduled 7 community listening sessions, 1 in each of our 7 geographic zones. Those are scheduled throughout February. And our listeners and viewers can learn the dates and locations by visiting our website, dhcd.org. And also we're on Facebook and Instagram. Why would you encourage, or what would you say to encourage your residents to actually attend and participate?
Yeah, when we talk to clients and partners who are interested in doing this work, it's usually because they are so passionate about being impactful. And that is something that we've seen from the board of directors, from members of the staff, connecting with members of the community. Everyone has very similar goals, and it's all about how do we reach those goals? How do we make the biggest impact to support the most people? And so one thing that we want people to understand is that this is their opportunity for their voices to be heard. There are so many people who want to listen. They want to understand. They want things to be very clear. And so if you have ever felt like your voice hasn't been heard or your community has been missed, this is the opportunity to do. We want people to be in the room with us when we have those conversations. We also understand that sometimes people can't make it. They have families, they have to work, or they just might be tired. So we understand that completely. And so this survey is an alternative option and opportunity to have their voice heard if they can't be in the room with us.
And to your point about wanting to reach as many people as possible, we are going to provide ASL translation, Spanish translation. You'll even be able to enjoy a meal at the community listening sessions. So we really want to get as many people participating as possible. What more can attendees expect to experience, to see at the listening sessions?
Absolutely. A welcoming and comforting and safe space, a safe space for you to be able to share your thoughts and insights. That's the most important thing. We want it to be as inclusive as possible and not just race and gender. We want diversity in age, background experiences.
Absolutely.
We want everyone to be in that room. We want to ensure that everyone has equitable access. So thank you for mentioning the translation, the options, and then eventually we will have some virtual sessions and we'll share information on details concerning that. But the main thing is that it's a safe environment for your voice to be heard. That is what you can expect at minimum. And then the other thing is you can expect to have a good time within our conversation. It is a serious topic for sure, but it is a good group of people who genuinely want to hear from you.
And I will add that you would be adding to or contributing to improving the health infrastructure in the Coachella Valley for future generations.
Absolutely. The work that we're doing is laying the groundwork for decades to come. This is just the start of this conversation. We're pulling in information from work that the district has been doing for decades, but we want to start to expand that to include as many people as possible. We want to shape the future health of the generations to come. We want to establish equitable access to those resources that people need to not only live a long life, but live a healthy life while they're a part of the Coachella Valley.
So ideally, what type of information you receive from the community that's going to be most beneficial to this plan?
Absolutely. So within this strategic plan, we've highlighted some key topics. We call them pillars, some key areas that we're going to discuss. I'm going to keep people on edge so they can come and learn more about those things. We want to know who needs the most resources within our communities. Where are the gaps? How many providers do you have access to? How close or how far do you live from a clinic? How easy is it for you to be able to talk to a healthcare professional? And even beyond your health, what other factors are impacting your access to be able to live a long and healthy life? Is it housing? Is it transportation? Is it your access to healthy food? We want to understand the context of their lived experiences so that we can also decide, is that something that we need to put in the strategic plan? Is it something that the district can do? Or do we need to identify the best partners to support that work? Because that's the other piece. The district can't do everything. And they shouldn't, because we have to find the best possible experts and partners to lift up to do that work. But we have to be very strategic and intentional about how we lay out this plan. So all of the information that we're gathering paints the full picture so that the district can be strategic and intentional with the dollars, their efforts, and the human resources that are a part of everything that they're leading.
Excellent. You mentioned earlier the survey. Tell me more about that.
So this survey, very brief, but very thoughtful and intentional. It's a survey that is going to be available online. People can access it through QR codes. I don't know if we were able to get the text messages. We might be able to do that as well, but it'll be available online and in person through the QR codes, and we are going old school with just pen and paper. So if you come into the room with us, you'll be able to complete the survey right then and there. The survey is asking about all of those things that I just mentioned. What is your current access to care? Where do you live? What are some of the topics that the district should be discussing while we talk about the strategic plan? What are some things that we need to keep in mind? Have we missed anything? And then even with those pillars, those topics that we're going to discuss during the community sessions that centers around the contextual experience of Coachella Valley residents, we want to make sure that there is nothing missing from that conversation. And we want to make sure that we are on point with that. So not only will we do that in the community sessions, we will also do that during the survey.
Excellent. So we have said the word strategic plan a lot, but how do you define a successful strategic plan?
A successful strategic plan is one that was inclusive, intentional, developed with the community in mind. It includes policy, partnership, measurement, and it creates impact. If we don't have all of those key components put together, then we've missed the mark. And that has been the process that we've taken. Step by step, we've asked some thoughtful, intentional questions. We reviewed a lot of the information that was already out there because we don't want to overburden the district, the staff, and the board, but also overburden the community and having to gather information that's already been gathered. So we did our part to understand the background and the history. The other piece is thinking about what are the desires? What are the standards that we have to meet? And then the most important part, last but definitely not least, is asking the community, are we on the right track? And if we aren't, where do we need to be? And another piece that I would add to that overarching point, what are and who are the partners that we need to be engaged so that we can be most impactful?
I love that. Any parting thoughts for our listeners? Anything more you want to say to inspire them to come out?
At minimum, come have a good time with us. At minimum, I'll say that jokingly, but it is an opportunity for your voice to be heard. The board of directors, the district staff, they genuinely want to hear your perspective. We are there to create the space and the opportunity. We understand that we are visitors in your home. And so we want to be there to listen. And if you have questions for us during those community sessions, we're happy to answer those questions. Representatives will be there. So the board of director that represents that particular zone will be there with us, and we'll have staff members available as well. So it is your opportunity to have your voice heard. With all that being said, if you cannot be in the room, please complete the survey. Absolutely. And share it with as many people as possible.
All right. To learn more about these sessions, as I stated earlier, please visit our website, dhcd.org. We're also on Facebook and Instagram. All the information is there. Dr. Geter, thank you so much for your time and for sharing the information about what you do in developing our strategic plan.
Absolutely. Thank you so much. My passion is for developing resources for communities. For 20 years, this is the work that I have been leading across the country. And so I'm excited to do it as a part of the district and to support Coachella Valley.
I love it. Thank you again.
You're welcome.
Thank you for joining us on this episode of Healthy Desert, Healthy You. This podcast is a production of the Desert Healthcare District and Foundation in Palm Springs, California. For more information, please visit the website dhcd.org. Our annual conference site is healthydesert.healthyu.com. This podcast is available at most major podcast portals, including Amazon Music, Apple Podcasts, Audible, Captivate.fm, Spotify, and YouTube Music. Thanks for listening. Be sure to subscribe.